This video will display our dovetail bone bridge preparation technique for a lateral meniscal allograft transplant. The anterior and posterior aspects of the meniscus allograft are identified and marked by an A and a P on the anterior and posterior horns of the meniscus respectively. Excess bone and soft tissue are trimmed flush with the posterior horn to aid in positioning within the tibial trough during implantation. The bone block is safely held with towel clamps to ensure stability of the graft and avoid potential injury to the surgical assistant. The meniscus is gently retracted with a suture and the posterior cut is carried out with a small handheld saw blade. The anterior aspect of the graft is cut flush to aid in positioning within the cutting guide. A handheld sagittal saw is again used to complete the anterior cut. The trapezoidal dovetail guide is placed on the anterior and posterior aspects of the bone block, ensuring the dovetail is facing laterally toward the meniscal body. This is then outlined with a marker to be used as a guide during preparation. The superior and medial aspects of the bone block should be flush with the superior and medial borders of the trapezoidal guide. The allograft is then placed within the meniscus workstation posts. The allograft is positioned upside down with the meniscus hanging freely. Ensure the medial edge of the dovetail marking on the bone block is in line with the vertical aspect of the holding posts. With the allograft properly positioned upside down, place cutting guide number 1 so the vertical edge is in line with the medial outline on the bone block. The flat edge of a saw blade can be used to ensure the vertical surfaces of the holding posts and cutting guide are flush. A sagittal saw is used to complete this vertical cut. Any excess soft tissue may be trimmed. Cutting guide number 2 is then placed so it is sitting flush against your initial cut from the previous step. The superior aspect of cutting guide number 2 should also line up with the horizontal marking on the bone block. Make this horizontal cut with a sagittal saw. Cutting guide number 3 is then placed. This angled surface should be in line with your angled marking. Start this cut with a sagittal saw. Ensure the meniscus and attachments are protected while using the saw. This cut has the potential to amputate the meniscus from the bone block, and we advocate starting the cut using the guide, but completing the cut by hand under direct visualization to avoid any damage to meniscal attachments. Once the cuts are complete, inspect for any excess soft tissue and remove if necessary. Place the graft in the sizing guide to ensure proper size and to confirm accuracy of cuts. If necessary, a rasp can be used to smooth the edges of the graft. This concludes the preparation of the dovetail bone bridge for a lateral meniscal allograft transplant.